Ajit Menon. I'm a cardiologist associated with the Sir HN Reliance Foundation Hospital in Mumbai. As a practicing cardiologist, what we do see is that there's an immense increase in the number of cardiac patients that we see, especially in the younger age group. I would say that now today, if you cross the age of 50 without a cardiac ailment, you should consider yourself quite lucky. A majority of our patients are in the age group of 35 to 45, and that's quite surprising considering the fact that cardiac disease was supposed to be a disease of the elderly. It was supposed to be seen in people who are 50 plus, and a couple of decades ago, the number of patients in the age group of 50 plus far exceeded the number of patients in the age group of 35 to 40. So now, what has changed over the last few years? I would believe that cardiac disease is probably a lifestyle disease. Amongst the lifestyle cardiac diseases that are there, coronary artery disease or development of blockages in the arteries is one of them. The others being hypertension and diabetes, and both are increasing in terms of the pandemicity and the rate of increase in the numbers of hypertensives and diabetics, especially in the younger population. And we are already a diabetic capital of the world. Now, when we look at certain risk factors that cause coronary artery disease, there are certain non-modifiable risk factors such as genetics, heredity, the age of the patient, and these are factors which are non-modifiable. What can you modify among the risk factors? What you can modify among the risk factors are hypertension, diabetes, obesity, basically in terms of cigarette smoking and other factors which affect the heart in an equal way. When we look at trying to prevent coronary disease or reduce the incidence of heart disease, these are factors which we can try and control. And amongst that, I think nutritional balance becomes extremely important and plays a very important role in taking care of your overall health. When we look at nutrition, our intake of junk foods has increased drastically. Our intake of regular, good, healthy food has reduced quite significantly, basically because of a want of time, a want of space for youngsters who basically work pretty long hours, and when they come back, all they need is a quick fix and a quick food. My recommendation to everyone is that eat healthy. Increase the amount of fiber in your diet, increase the fiber, the content of fruits in your diet, and have natural food as much as possible. For those who are used to eating non-vegetarian food, my recommendation would be that avoid red meat as much as possible. And if it's not possible, have it once in a while. And chicken and fish are quite good as far as food, the nutritional value is concerned. Also, the content of cholesterol in these foods is concerned. Lean meat is definitely better. And when you talk about seafood, avoid anything which contains shells. For example, your prawns, your lobsters, shellfish, crabs, etc., are to be completely avoided. If you look at the food chain, there's a pyramid in the food chain. And the largest and the bottom of the pyramid would be the foodstuffs that are healthy for you. That is in terms of green leafy vegetables, salads, and those substances which increase the fiber. How does fiber help? Fiber helps not only in increasing the nutritional value of the food, but also it reduces the absorption of cholesterol and those constituents from the intestinal tract. So it has a double effect, and it helps you in terms of not only maintaining your weight and your blood sugar levels, but also in terms of maintaining obesity. In terms of obesity, let me tell you that even a thin person who does not look obese on the outside can have a certain amount of visceral fat, which is much more than a European counterpart who has the same height and the same weight, or technically the same body mass index as an Indian individual. And that difference is quite staggering, wherein you can say that an average European would have a visceral fat of 7%, an Indian would have a visceral fat of about 20 to 21%, which is exceedingly high. And that is what determines your propensity to develop coronary artery disease. So my advice to you as far as diet is concerned is eat healthy, and live longer under these circumstances. And of course, you need to be very sure that you control your other risk factors, avoid smoking, moderation in alcohol, regular exercises, control your cholesterol, control your diabetes, and control your blood pressure if you have anything. And if you have a strong family history, please be careful that you keep a regular check once you are beyond the age of 35 and maintain all these parameters which can be managed under control. What can't be managed is something beyond your control. You cannot change your family, you cannot change your gender, you cannot change your age. These are factors which are beyond our control. Thank you.